This is all very good news. We've had an extraordinarily good uptake of the app that we introduced, the COVID Safe app, only 2 weeks ago today, and 5.4 million people have downloaded that app. And I know that of yesterday we have had almost all of the states and territories have signed up to be able to use this app for their contact tracing, and so from early next week that will be definitely available around Australia. So that's the data. I think yesterday everyone knows, and it's been extensively covered in the media, about what's really a watershed moment for our response to this virus in Australia with the publication and announcement of the roadmap, that three-step framework for us to restart the economy and our social life here in Australia, whilst being cautious about the virus which is still with us. So that roadmap is clear. It goes into many different sectors of our society and the economy, and how that will be envisaged to open up over the coming months. A couple of things about that. This is a roadmap. We are all on the same road across Australia. It's just that different states and territories have had different starting points, and they will be using that same roadmap but at slightly different speeds. I want to really be clear, there are no roadblocks in this roadmap. The only one that we will have potentially, and this is why we're being cautious about our restart of these various activities, is the virus itself. We know it's very infectious. We know that infection increases the more we interact with other people, and so we still need to remember those same general principles we've been talking about for many weeks now. That concept of social distancing, that concept of not gathering in large groups, and so whilst different states and territories have announced different things they're going to be opening in the coming week or so, that same principle of not more than 10 people gathering is an important component of that. The reason is we don't want to have too many people interacting and thereby allowing the virus to spread quickly. Those other same messages that we've been saying for all these last few weeks about hygiene, about cleaning, about washing your hands, about sneezing into your elbow, all of those things continue to apply. And most crucially, if you are sick, stay at home unless you are needing to go and seek medical care. The final point I'll make before I open for questions is about elderly people. So we do know that people over the age of 70, and particularly those with chronic diseases, are more at risk of the severe end of the virus and how it affects our health. And so for people over the age of 70, I just would say be cautious over these next couple of weeks. Even if things are opening up and people are gathering, shops, cafes and so forth are now available, for people over the age of 70, I would just urge caution about your own health and consider that, including having people over to your house. So this has come to us in various ways through the Council of the Ageing and other peak groups, as well as individuals who have asked us a bit over the last 24 hours about what is the advice for older people. And so that's why I'm stressing that one today at this press conference. So I'm happy to take questions.
Professor, with the COVID Safe app, you say that almost all states and territories have signed up. So which ones haven't, and why is that the case?
I think it's just a timing thing, and so as of yesterday afternoon, I believe that 7 out of the 8 had signed, and to be honest, I can't quite remember which one it was that hadn't. But I'm sure that will all be it's just a timing matter, and by Monday everyone will have signed. So there's been a couple of steps to go through to allow the data to be used by the states and territories. The first one was an agreement, and essentially that was about using it in the way that's the manner it's supposed to be used, and the way we've had our our discussion with the Australian people about privacy, security, and only using the data for the purpose for which it is being collected. And the second one is a small training module which has been rolled out as well to all of the states and territories that have signed up, so and will be available to all when they have signed.
The roadmap outlines stage 1, 2 and 3. 3 limits gatherings to 100 people. Are you working on a stage 4 or 5, and when can we expect to see those?
Yes, so the National Cabinet, when they asked the Australian Health Protection Committee to work through this, and it was quite a process, I'll say. There was a lot of discussion amongst my state and territory colleagues and some different opinions about what should be in stage 1 and stage 2 and so on. But we came to an agreement, and that was presented to National Cabinet in draft on Tuesday and the final one yesterday, and they've agreed to those 3 steps. You're quite right, the third step is not quite back to normal as it was before COVID-19, and I think we've been quite open about this from the beginning, that the new normal, the COVID-safe normal for Australia, may not be the normal that we were used to prior to January of this year. But there are a number of things in a kind of 3+ stage, which we felt would almost certainly not be in stage 3, but when they may be able to be recommenced it's too far in the future at this stage to consider an actual date. So there's no stage 4 as such, but there are a number of things. For example, the opening of the borders to international travel. That's one that so far into the future we weren't really sure how that might actually happen yet. Other than, and this has been discussed already quite a lot between Prime Minister Ardern and Prime Minister Morrison about the so-called Trans-Tasman bubble and how that may also include some other parts of the Pacific if we were all relatively COVID-free at some point in the future. And so that concept, at least, appears in stage 3.
Do you think realistically we could attend sporting matches though by spring, summer, or do you think we'll have to wait till next year?
Well, there are some iconic moments in Australian sport coming up in that period. The last weekend in September is dear to many of us. Look, I must admit I'm doubtful that we'll be able to fill the MCG by that time. But let's see how we go on this road. We have a roadmap for the next few months, and it may be bumpy. In terms of the virus, we have to really be very vigilant about that, and the testing regime is there for that purpose. Our contact tracing exercises are there for that purpose. The app is there for that purpose, and so we need to really keep considering where we are. And stage 2 will only happen if the stage 1 lifting of restrictions is successful. And so we're saying that will happen in about a month. That's certainly the plan, because we need that amount of time to see what is the effect of this first stage. And once we can see that, and if we continue to see the flat curve, then we'll move to the next step.
So that success, what does that actually look like? Is there a certain number of, for example, new coronavirus cases? Does it have to stay below a set figure in order for medical authorities to say, yes, states and territories, you can proceed to stage 2?
So that's one of the components, yes. Certainly if there was a large increase in cases over the next few weeks, that would be a concern.
What's large?
I'm not going to go into an actual number, but certainly larger than it is now. About 20 a day is very manageable. But more than the actual absolute number is really about where those cases are. If we were to see lots of cases around a dispersed geographical area, then that would be more concerning really than a specific outbreak like we're seeing in Western Melbourne at the moment. So that's a contained area. We know where that's come from. We've stopped, we've closed that facility's been closed. All of the people that have been diagnosed are in self-isolation. Their contacts are being traced. And so that even though that's a relatively large number of cases, over 70 now, it's a specific point. And so that would not be as concerning as, finding a few cases in eastern Melbourne or central Melbourne and in Geelong and somewhere else, not just picking on Victoria or anywhere in the world, anywhere in Australia. But so it's the dispersing, it's the number. It would be an increase in terms of percentage. The R effective, as we've talked about before, is part of that process to see whether, on average, one person is leading to more than one person in a second infection. All of these things would be concerning. On the other hand, if there's very few cases, or those cases are mainly coming from people returning from overseas and are already in quarantine, even if that was a relatively large number, that wouldn't be as much of a concern to the wider society. There are other elements. We need to look at our capacity to respond to the outbreaks, and so we are measuring how quickly people are being traced, and again, the app is a very important component of that. We are also looking at a range of other measures in relation to our health services, and so with so few people in intensive care, way fewer than we thought might have happened at this time without the mitigation that we've had, but we'll keep a close eye on that, as well as our PPE suppliers and so forth.
Just on mortality rates, looking across the world, why do you think it is that countries with the highest mortality rates are actually really wealthy countries?
Yes, so it is. I think the mortality rates and the numbers of cases, we need to consider the situation of the different countries. So I think, firstly, those richer countries with first-class health systems like our own are able to find people and to diagnose them correctly. And so those large numbers, over 1 million people in the US, several 100,000 in several European countries, these are enormous strains on a health system. I think even there, though, in the UK would be an example of this. I don't think they're seeing the full extent of the epidemic. They're mainly testing people as they come into hospital, and so we know that once people are sick enough to come into hospital, their mortality rate is higher. It's often older people or people with chronic diseases. We're finding the same in Australia. So if you end up in hospital, so sick to be in hospital, then your chances of survival are much less than if you're able to stay at home, and that kind of makes sense. So I think for some countries, they're not counting those ones that are at home so much. They're not getting as many tests out, certainly in the early stage of the epidemic, and it's improved over the last few weeks with more laboratory testing available, as it's been the case here in Australia. So I think that's part of it. I think when you look at some of the other countries, in Africa, for example, I'm sure they are completely underestimating their problem. Some countries in Asia are finding even higher mortality rates. Again, I think that's because they're only seeing that very severe end of the spectrum. So testing is a great help, but not everyone who is sick in the world or has been sick in the world have been tested. So those rates we have now, millions of people with the virus, it's probably even more than that actually that have suffered.
Just finally, on Mother's Day, you talked earlier as well about older people over 70. Is there specific advice whether you can hug mum or not? If you don't live with her, should you maybe not go into her home and chat outside? What would your advice be?
So I think individually people have to make that choice, and it really depends a bit on the age of your mum and whether she has other diseases that might make her more severely affected with COVID. I think absolutely, if you're feeling sick yourself, don't go and visit your mum. Please don't. If you're feeling well and you really want to see your mum, I'm sure that's fine. But for elderly mums, just be a little bit cautious and probably keep that 1.5 metres distance for now. I know it's hard, and we all want to cuddle our mums on Mother's Day, and big shout out to all mums out there. But let's just wait a little bit longer. Thank you very much.